Good morning to our oral health stakeholders. I'm Billy Hall, the Vice Chair of the Louisiana Oral Health Coalition. Today, we want to welcome you to our pre-conference webinar entitled Understanding Oral Health Inequities. This webinar is the first event in conjunction with our annual Oral Health Summit. The 2021 Summit will be held on Friday, March 12th, 2021 at the WK Innovation Center in Bossier City, Louisiana. More details will be coming soon. All of you attendees have been muted and the videos are turned off. There will be a question and answer session toward the end of the webinar. We ask if you would please put your questions in the Q&A box and they'll be addressed accordingly toward the end of the seminar. Louisiana Oral Health Coalition, it's a voluntary collaborative representing oral health interests throughout Louisiana. There's over 40 organizations and other individuals such as dentists, hygienists, pediatricians, nurses, and community advocates dedicated to improving the oral health of all Louisianians. The Louisiana Oral Health Coalition has made a commitment to improve oral health by utilizing evidence-based best practices that will better use the resources at hand. Our vision and mission, which you can read here, are simple, yet they seek to make a profound impact in the areas of access, prevention, workforce, and policy.
Today's objectives will highlight approaches for advancing oral health equity. Participants will learn effective strategies on how to pioneer state oral health policies to reduce oral health inequities and increase access to oral health care for underserved communities. This webinar will cover 3 presentations. Now we have our first presentation, Oral Health for All Policy Landscape, brought to you by Melissa Burrows. Melissa Burrows is the Senior Oral Health Campaign Manager at Families USA. Since 2016, she has led Families USA Oral Health for All campaign to improve oral health policies that drive health equity, expand oral health coverage, and support access to care. Families USA is a national nonprofit, nonpartisan organization dedicated to the achievement of high-quality, affordable health care for all Americans.
Hi everyone, can you hear me?
Yes.
All right, great. I just wanted to make sure since we're not doing video. All right. Hi everyone, I'm Melissa Burrows. As I said, I'm the Senior Oral Health Campaign Manager at Families USA, and I'm going to talk about the policy landscape for promoting oral health. Talking about it broadly, but I'll share a little bit about what, some of the election outcomes, or at least what we understand the election outcomes to be at this stage, mean for oral health policy as well. And I really appreciate you all having me here today. I'm disappointed I couldn't come to Louisiana in person, but hopefully one day that'll be possible. Next slide, please. So just briefly, you heard the background about who Families USA is and what we do, but I do just want to emphasize that if we are working towards high quality, comprehensive, affordable healthcare and improved health for everyone, that has to include oral health care and improved oral health. And we really are focused on that, and we have a specific oral health campaign that I'll talk about just in a second. So go to the next slide. And our oral health campaign is centered around several policy goals. One mostly related to expanding oral health coverage for all in different health insurance programs, but also part of our big push is to raise the profile of oral health as a health and healthcare issue. It's one that we know all too well is often left behind in broader healthcare discussions. And so our charge at Families USA is to elevate oral health and policy discussions that are about healthcare, to empower the oral health community through coalitions like this one, through other networks to make sure that you all have the tools and the information you need to advocate for oral health policy change. We convene and activate a national coalition of allies in support of these goals. And we also support efforts happening at the state level to improve state policy, providing technical assistance to state partners, and also elevating state wins to help drive that national narrative around the importance of oral health and the fact that oral health policy change is important and possible. So that's who I am and what we do. And now I'll get into the landscape part and go to the next slide. So this probably isn't a surprise to any of you all. I think the two major things dominating the policy discussion and the political discussion at the moment are COVID-19, both sort of the pandemic, and right now that's really the focus is, the pandemic and the fact that cases are going back up and, things are not good from that perspective. But the other piece to remember is that the COVID-19 pandemic is also what's causing our current economic challenges. And so between, the pandemic itself and the economy as a result, those are the two trends really shaping how policymakers and the public are thinking about healthcare, and also shapes how they'll think about oral health. The other thing that's obviously shaping the conversation are the 2020 elections. They're shaping the politics around healthcare going forward, but they're also, taking a lot of focus and energy away from specific issues and kind of bringing it into the political theater realm, and also throwing a lot of uncertainty into what exactly will be happening in Congress and at the federal level in the coming weeks and months, but also there's some things we can make predictions around at this point as well. The other two things I'll briefly mention that aren't driving the ship as intensively but do matter are our country's increased focus on racial justice that's really happened since the death of George Floyd, and has sparked outrage and protests, as it very well should in many places. I think that there's a new national understanding around things that many of us have been talking about for years around health equity and social determinants and systemic racism and injustice like that. And so I think that's just something to keep in mind, that there's more of a public narrative around that, and policymakers are thinking about it a little bit more. And it's certainly, not driving the conversation the same way now as it was a few months ago, but it's something that will continue to be vitally important for us to think about as we promote oral health, and certainly, is something that we want to connect oral health policy to. And the other thing to keep in mind is that oral health is not top of mind for most policymakers or for the public for the most part. However, it's much better understood at the federal level, and in many cases at the state level, and in the media and all of these different audiences. Oral health is much better understood now than it was 5 years ago, and definitely 10 years ago. So there really is a growing oral health advocacy movement. I think open is to thank for a lot of that, but also coalitions like yourselves have really done a lot of important work to educate, your members, your policymakers, the media, bringing in new groups that work on other issues. I think the fact that we're seeing that increase in understanding is really important, and something that we can continue to leverage as we, are navigating this bigger landscape. So that's where we are in a broad sense. And you can go to the next slide. From a policy kind of health coverage perspective, or healthcare perspective, the conversation will largely continue to be around health coverage, and that's going to be kind of the biggest bucket of policy issues that affects oral health policy, and particularly oral health coverage policies. So this is largely at the federal level that we're talking about right now. The big driving healthcare issue will first be the COVID-19 pandemic, which will be kind of an effort that puts resources into the system, but doesn't necessarily change how the system works. What I have on the slide here are things that maybe change how the system works. So there will be continued broad discussions around health coverage. Many people are losing their health insurance due to the pandemic as they're losing their jobs. There will be, assuming that we end up with a Biden administration, there will continue to be discussions around health coverage improvement. I don't think we're super likely to see something like a push for a public option or the big Biden healthcare plan that he's been talking about for months. With the way Congress dynamics are most likely to play out, although that's possible. And if that discussion is happening, we want to make sure that oral health is part of that discussion, and making sure we're really paying attention to what those new health coverage efforts would really, what services they would really cover. But the other thing to keep in mind is, even if a big package like that is not moving through, there is still the healthcare repeal lawsuit that the Supreme Court will decide probably in May or June, which could throw out, some significant portion of the Affordable Care Act. And if that were to be the case, many people would likely lose oral health insurance. So as policymakers are thinking about how to react to that lawsuit, if it were to be decided that way, that it'll be important to make sure that oral health is part of that discussion as well. I think the other things to keep in mind about the policy landscape are that Medicare currently excludes oral health. So, there are strong efforts right now to add dental coverage to Medicare. I'll talk a little bit about that later, but that's not likely to be a top priority given the dynamics in Congress we're seeing coming out of the election. That could change. And the other thing to keep in mind is, there will always be this sort of ongoing discussion around who has access to Medicaid as a health insurance program. Who is covered by the Medicaid program? Can they get the care they need? Are people able to get coverage when they need it now during the pandemic? Are they losing coverage because of, paperwork barriers and things like that? That's something that will be definitely a piece of discussion at the federal level, but something I'm going to dive into in a minute is just how much Medicaid is a focus of discussion at the state level right now, because state budgets are tight, and that's the other piece of what's going to affect the Medicaid landscape. A couple of other things that we think are likely to continue to be top of mind for Congress include maternal health. And as you likely know, oral health coverage for pregnant women who rely on Medicaid for their health insurance varies widely by state. And so the fact that there's bipartisan interest in improving maternal health in this country, there could potentially be some interest in including oral health provisions for pregnant women, whether it's related to coverage issues in Medicaid or other things. It's hard to say, but that's a possible area we could see some movement. And then there'll be other things that we can be thinking about at the federal level, like program funding for things like school-based healthcare, or for CDC oral health program funding grants that go to the states. Things like that could move in sort of the bigger federal budgeting process, or be considered as part of some of the relief efforts that are going to states coming out of Congress. So those are all the big issues, and I know they're kind of wonky in some cases, but I think if we're thinking about the things that are most likely to have federal movement this year, those are the different avenues we want to be looking at, and they all affect sort of how things are playing out at the state level too. You can go to the next slide. So now I'm going to talk about the Medicaid landscape. I think this is probably the biggest issue that we need to be thinking about at the state level, so I'm going to focus in on that, though I will touch on some other state issues later on. Go to the next slide. And I think the biggest things to focus on in Medicaid policy right now are, Medicaid adult dental and how it's being affected by federal policies. As you may know, states do not have to offer Medicaid adult dental coverage, and they don't have any, amount of, if they do offer that coverage, there's no standard as to what that has to look like. Federal legislation could change this, but that's unlikely to happen in the short term. So because of that, we're seeing a situation in which states are very likely to be considering cutting what they do have or scaling it back because state budgets are so tight around the country due to the COVID-19 pandemic. Some ways to offset those issues with tight state budgets include, there could be federal legislation that would offer relief to states and to provide fiscal support. There also could be federal legislation that's offering relief that also goes farther and protects adult dental coverage, saying that you can't cut services people rely on to stay healthy during a pandemic. There was a provision like that in place for much of the pandemic, although recently it was reinterpreted and just no longer protects adult dental coverage. So this is something that you all want to keep in mind as Louisiana starts setting its budget for next year. You know, there could be considerations of cuts for Medicaid adult dental, and you want to make sure that state policymakers understand that that would be a real hit to Louisianians' health, and something that doesn't make sense in the middle of a global pandemic. There are some other really wonky things that can affect Medicaid adult dental coverage. Medicaid agencies have some special authorities during a public health emergency, which we are currently in and are likely to be in for some time. So, you know, there are things that states can do to improve access there, and I'm happy to answer questions about that if folks have them. And the other thing just to keep in mind are these things that the federal government can do to protect oral health access as part of its effort to support states, which, you know, may or may not happen in the next few months. Congress will probably pass some level of support for relief, but it may or may not include funding for states. So another package is likely to happen in the new year. And any of those could increase the funding levels for Medicaid so that the federal government is covering a higher percentage of Medicaid costs for the state. It could provide fiscal relief where it's just giving the state, you know, a chunk of money to offset their budget holes. The other thing they could do is provide direct funding for certain programs. It's possible, and the Open Network has pushed for this, that there could be something like funding for state oral health programs that like supports sort of the public health model of oral health. That's probably the least likely of these options, but that's what's shaping the whole issue around Medicaid adult dental, and it is an area where the oral health community really should be thinking about defending what we have and doing some federal advocacy to make sure that the incentives don't make it so that states really feel like they have to cut oral health coverage even if they don't think it's a good idea. Next slide, please. And this is just to show, you know, where Louisiana is in comparison to other states in terms of what it offers in Medicaid adult dental coverage. Louisiana certainly offers more than some states, but it is limited, and a lot of other states offer somewhat more comprehensive set of services. So, you know, there's definitely some important things that the state could choose to cut. But I think, you know, as you'll see in a moment, there actually has been some efforts to expand and improve adult dental coverage despite tight budgets. So, you know, keep that in mind too, that if the discussions are opening up in a way that seem like, you know, there may be room for improvement, it's possible and it's worth going after. So you can go to the next slide. And so this is what I was just talking about, how even in 2020, in the midst of the pandemic, in the midst of, you know, state budgets really getting squeezed, West Virginia, Maryland, Oklahoma, Missouri, and Illinois all moved forward with efforts that expand access to adult dental coverage in different ways. Some efforts got really far and then stalled out kind of at the last minute because of budget pressures, including efforts in Virginia, New Hampshire, and Delaware. However, those made such significant progress that we don't expect there to be cuts coming forward. So I think that shows that there is really value in pushing this issue forward, even if your effort may stall out sort of at the end of the road. That said, we also saw, you know, early leaders in looking to cut what they have. Colorado was the one state that did pass cuts that are already, you know, able to go into effect. And we also saw proposals for cuts in California and Nevada. However, strong advocacy got those proposals out of the final budget. And so I think that's just important to remember, that strong advocacy can overcome proposals to slash services. So Medicaid adult dental really is something that I think every state needs to be thinking about right now, because there's a lot of ways in which it could be scaled back. But I think the main reason to think about it is because, you know, moving forward on protecting that coverage can position your state well to expand coverage in the future, and also it means that you can ward off some of these proposals to cut. Next slide. And so this is kind of just a summary of where we are. As I mentioned, there's a new federal rule that allows oral health coverage to be at risk. So we're thinking about defense. We're likely to see proposed cuts in many states from legislatures and governors, so that's what we should be watching for. Something that I think is in Louisiana's favor, though, is you know, your state level policymakers didn't change over this election cycle. So all of the great work that has been coming out of your coalition and your partners, and you know, sort of the strong advocacy that's been happening, is a foundation to build on. I think there's, you know, whatever education has been done is a floor, and you can just keep building on relationships and on information that you've been putting out into the world. So I did just want to mention that as sort of the next piece of context as you move into the legislative session for next year. Go to the next slide. So now I'm going to pivot and talk a little bit about the federal level more, honing in on Medicare oral health coverage, just so you have a sense of where that issue stands. That's something that Families USA works heavily on, and will continue to work on until we are able to succeed in this effort. And we hope that we can partner with a number of you on this over the long term. And it's also something that I think is getting a lot of bipartisan interest, although it's not something that is likely to be prioritized, but it could be shaping the oral health conversation, since it is sort of one of the oral health issues that most federal policymakers have heard about in some way or another, whether they're willing to take action on it. Next slide. So just so you understand sort of how this issue applies to Louisiana, got a large number of seniors and people with disabilities who rely on Medicare for their health insurance in Louisiana. And most of those people will not be able to access dental coverage because it's not included in the Medicare program. Certainly some people can get it through other insurance programs, or if they have a Medicare Advantage plan, they may have dental coverage. But for the most part, those nearly 800,000 people do not have dental coverage. And as a result, we do see you know, outcomes that reflect the fact that people aren't able to get the care that they need. 21% of older adults in Louisiana have lost all of their natural teeth due to oral disease. And this data is from before the pandemic, but 45% of older adults in Louisiana have not seen a dentist in over a year. I would imagine that's probably higher at this point, as dental offices were closed and there's access issues with that. So that's why we're working on this and what it means for Louisiana. Go to the next slide. And there's sort of two ways that this could come up at the federal level. One that would, you know, be the most effective at bringing the care and coverage that people need, is, you know, getting Congress to pass comprehensive legislation that would add oral health coverage to Medicare. That would, you know, be a really big deal and would be a pretty significant effort and maybe pretty difficult in a divided Congress, although there are some opportunities that could come up, and I'll be sure to stay in touch with you all to make sure you understand when those opportunities are coming and when it might be helpful to continue to educate your policymakers on this issue. But that's sort of one route. And then the second route on the next slide, that may see some action, you know, in the shorter term, is this effort to push for medically necessary dental coverage. There's a school of thought that Families USA very much agrees with, that current law allows for Medicare to cover dental procedures that are connected to a health procedure or medical procedure. Dental care is certainly a health procedure, but a medical procedure that's already covered by Medicare. So under this ruling, under this interpretation, the way we think the law should be read is that if you need something like a kidney transplant, but you have a gum infection, the treatment of your gum infection should be covered by Medicare because it's essentially part of this other medical procedure, your kidney transplant. This is very narrow and doesn't go nearly as far as what would be helpful under a big legislative push. But moving this forward as possible would expand access to needed dental care. And it also is something that, over the long term helps raise the profile of Medicare oral health issues. And so there's a lot of work that's been done with the Trump administration to move this forward. And so I think that whether we have a Trump or Biden administration, this is something that would continue to get attention and could potentially move quickly under a Biden administration and more slowly under a Trump administration. But either way, there's opportunities to improve. So that's something that, you can elevate in your conversations, that there are some avenues to move forward in the short term, and that can, add some additional pressure to the administration to act. So that's where we are on Medicare. And you can go to the next slide. A couple of other issues that I'll just flag for you all that may come up in your work that are part of this political landscape. At the federal level, there is the whole appropriations process to set, what funding the federal government will put out into the world. And through that process, state oral health program funding is something that, is already out there for some states, but is only available to a small handful. And so there's a worthwhile advocacy effort to expand that funding to be available to all states. There's other program funding that will be at stake, including dental loan repayment programs, National Health Service Corps, funding for outreach and education programs. And I think, just so there'll be other sort of issues, as I mentioned, around maternal health. There's been some interest in providing oral health coverage for former foster youth. We saw a bill come up on that just in the past few weeks. And there is also some interesting work being done in Congress to provide a little more oversight of health insurance plans and specifically Medicaid insurers. So that's something that we don't really know what the impacts will be, but is interesting to watch. At the state level, on the next slide, there will be, other things you'll want to be paying attention to in the budget process. Even if Medicaid adult dental coverage itself isn't at risk, your state budget may provide funding for things like school-based health programs or sealant programs, or maybe you have some kind of specific program to provide care to a certain population, like older adults. Those kind of specific program funding items are other things that could potentially be on the chopping block and that you'll want to protect. The other thing that is similarly situated is reimbursement rates for dental care that you'll want to watch. Of course, there are also ongoing issues that I know you all have been working on workforce, scope of practice, teledentistry. Those will all continue to be relevant and move forward in various ways. And so they're definitely worth continuing to focus on as we move forward. So that's the net of what's out there to keep track of and weigh in on. And I'll just wrap it up on the next slide with how you can get involved and do more around advocacy in the policy landscape. So the first thing, if you are not already a member of the Oral Health Progress and Equity Network, that's the best place to get information about all of these issues, stay up to date, look, get action alerts, know how to activate, and also just how to keep on top of all of these different issues. If you want to dig deeper on either of the two coverage issues I mentioned, there is a learning collaborative around Medicaid adult dental benefits for folks from different states to share information about what they're working on and how it's going, and to get resources they need. There's also an Action for Medicare Dental learning collaborative for folks to share information about how that effort is going and how they can most effectively activate, recognizing that for many state and local level stakeholders, that federal action is difficult and challenging and something they can't expend a lot of resources on. So this is a place to come learn how to do it as in a low a lift way as possible. And then finally, two things you can kind of do on your own or coordinated as a coalition are engaging your policymakers as we move into 2021 at the state and federal levels to introduce yourself, introduce the coalition, make them understand that you are a resource to them on these issues, and kind of elevate the profile of your own organization's brand, but also of oral health issues. And then finally, for those of you that work with patients or in communities, or if you have your own oral health story, something that is really important to all of these efforts is that policymakers and the public understand what impact oral health has on real people. So thinking about sharing your story, whether it's on social media or with the earned media, or through Families USA's website, we have a story collection page, which is in the resource links on the last slide. That will, really, really go a long way to moving some of these issues forward. So those are opportunities to get involved. There are many other ways to get involved, and I'm happy to talk about that with any of you that are interested. But I know I'm just about out of time, so I will wrap it up, and just thank you all so much for having me today.
Now we will hear more about the Oral Health Progress and Equity Network.
Good morning. This is Celeste Terry, the Louisiana grassroots representative with Open, and Lisa Staples, the oral health lead, who is with Eat, Move, Grow, but serves as the state representative for Open. We both work together on different issues as it relates to the Oral Health Progress and Equity Network. And today we're coming to join you with the pre-conference prior to our inability to be face-to-face. So today, next slide, please. Next slide. So today we will be coming to you to explain to new members or first timers what Open is all about, and how we have chosen as a network to use the network approach to reach our goals and to overcome some of the challenges that we face. And we also will be talking about the Open Communities, which is a new platform that previously, for those who may have been involved with Open, we were using Socius, but that has since changed. So we'll delve into that a little bit more today. And of course, we do want you to know how to become a part of Open. So we will discuss how to join, and we will share out some resources that are available through the Open Network as well. And last but not least, we will discuss what's ahead and how you can get involved with the Open Oral Health Equity and Progress and Equity Network. Lisa, next slide.
Okay, hello everybody. Like Celeste has introduced, my name is Lisa Staples. I'm excited to be here in this space. Thank you, Well Ahead, for hosting this webinar, pre-conference webinar for us. So like Celeste mentioned, today we're going to talk about Open, and Melissa gave a wonderful introduction to the Open Network. But just to get started, Open, the overall goal is to connect oral health with overall health, not just, physically, but also mentally, and knowing that oral health concerns or issues have a multitude of comorbidities related to poor oral health. And you can go to the next slide. And how it just really impacts the social outcomes in terms of employment, in terms of that could translate to lost earning potential, and it could increase healthcare costs as a whole. Next slide. And so talking through the Open goals, that given what we know and given what is true about oral health and lack of access to oral health care, or the Oral Health Progress and Equity Network has created these goals to help bring that all together and to bridge that gap.
So the all goals that Open has chosen include eradicating dental disease in children, as well as discussing ways to include adult dental benefits for those who don't have coverage. But the goals that we are going to focus on as it relates to the Louisiana Oral Health Coalition and some of the work that we are doing are going to be looking at building a comprehensive national oral health measurement system, which will allow us not only to track what we're doing in Louisiana, but also across the nation, and to be able to determine what may be working better in other parts of the United States that we may be able to duplicate here. And another one of Open's goals, integrating oral health into person-centered healthcare, has been something that the coalition has been working on for years. And we have made some progress in our collaboration with the Louisiana Primary Care Association, as well as the Workforce Group and the dental schools, and especially the members of our local components and the coalition. And lastly, but not least, we are going to be joining in focusing on another goal that Open has, and that is improving public health, public perception of oral health and how that relates to overall health. So often we have had discussions about overall health, and like Melissa said in her presentation, often oral health is excluded. And we have been addressing that as a coalition, as well as the national network, in terms of how we can improve public perception. We will continue to work on these goals. Next slide. And Open is very committed to making change, and we do that through catalyzing a network to take on America's oral health challenges so that everyone has an equitable chance to thrive. As Melissa stated earlier, we know that access to care and equity issues are not prevalent on it for every person in our communities. And we're working as a network to make change in those areas. Next slide.
And so here we have a visual of the Open organization and infrastructure. It is a lot and it can be overwhelming, but the main thing to focus on is what is highlighted in the blue in the middle, where it says Regional Oral Health Connections Team. It says state and grassroots rep. That is where Celeste and I come into play. Celeste is a grassroots rep and me as a state rep. We are the connecting bodies to connect our oral health stakeholders in our state to Open. And there are so many ways to get involved, and we can talk about that later, but just knowing that Celeste and I are your connection to the network. Next slide. And so next slide, we're going to talk about why the network approach. So what's great about Open is that it is over 2,000 partners and 2,000 people that are part of the network itself across the country. And so it does create a lot of opportunities for collaboration, opportunities for, different ideas and just assistance in projects and initiatives. And what's great is it's, as they say, why reinvent the wheel? No need to do that. Somebody in another state has probably done the work around different initiatives that are trying to be pursued. So reaching out to Open and the Open Communities platform, there's forums, there's listservs, there's just a bunch of opportunities to connect and access those resources around whether, even if it's creating a one-pager or if it's creating a toolkit, things along those lines are accessible thanks to the Oral Health Progress and Equity Network, even around policy and things along those lines. And so what's great is some calls are monthly, some calls are bi-weekly, or just every once in a while. So you can engage and have the opportunity to connect on a level that works for you. And then what's great is they always have webinars, or they always have opportunities to connect as a whole, and you can engage in whatever capacity works for you. Next slide.
So our network Open has changed from the Associates platform to Open Communities, and we're very excited about this change. Next slide, please. So now you are able to join our platform, which is the connector to the national stakeholders and members, our network members, as Lisa mentioned. And you can find ways to participate in forums through the Open Communities. Next slide, please. So this is an overview of everything that will happen once you get into Open Communities, and I'll go into a few of these buttons so you'll know how to connect. Next slide, please. First thing you will want to do to connect with the partners, which includes oral health advocates, stakeholders, practitioners, providers, funders, as well as citizens, and would be to create an account and join the Open Communities. And to create an account is free, so there's no choice to become a member or to become involved with Open Communities. Next slide, please. So once you connect with the Open Communities, you have the opportunity to explore what's available. You'll have the opportunity to collaborate with others on local initiatives, and to, as an example, we were able to connect with the Open Network and get our speakers for our first annual Oral Health Summit that was held last October in 2020, as well as our presenters day. And we have continued to network and connect with a number of the members of that Open Network. Next slide, please. So Lisa is involved with the Rural Network Response Team. I work primarily with the policy and Medicaid and Medicare collaboratives. And I work or have been involved with the schools as well as Open networks. Also, with as a member of the Open Communities, you are able to share expert knowledge and resources. You can upload documents and files that you have found to be helpful, as well as to take advantage of other resources that are available that others have provided in the network. And right now, we realize that we have oral health equity and social justice, so that is taking a higher level of focus in the national platform. Next slide.
So continuing through, we are going to walk through how to exactly join for those that are interested, and if you're not already a member, you can go to the next slide. So like Celeste has mentioned, we've transferred from Socius to now Open Communities, and you can go to the website https://www.oralhealth.network. And it's going to get put in the chat for those that want to get started and join today. It is a very easy application. You can go to the next slide. So for those that have had and created a Socius account in the past, you can go ahead and activate that already existing account. You just have to create a password. Or for those that are not a member at all, you can click create a new account and go to the next slide. And this is the information they'll ask for you to register. So it's either creating or activating an existing account that was previously made through Socius, or creating an account and starting fresh. and it's very basic information, and it doesn't take any time at all to register, and you get access to all this information. Okay, you can go to the next slide. So next, we are going to discuss some open resources. So here we can see that, unfortunately, due to the pandemic, Open has not been able to meet in person, but they have done a wonderful job in making collaborations possible on a national level virtually, just like we are doing a pre-conference webinar today. So what's great is in August, early August, they did 2020 Open Academy to replace our regional meetings where we would meet regionally with those southern states around Louisiana. But instead they had Open Academies, and it was just a really great resource to be able to connect with other partners in neighboring states. And so to access those recording and slides, you can access that. Once you create an Open Communities account, you can access all that information since it's there and it's housed on the platform. And then just last week, or 2 weeks ago now, we had an Open national meeting. Again, we would have met in person, not by region, but as a whole network nationally to connect with people on different oral health initiatives. So it definitely discussed, especially what is going across the country with all that's happening with racial injustice and things along those lines, especially with the policy landscape as it is changing, as Melissa explained, throughout our country and the current status we are in. And so there's just a lot of great information and related to oral health, Medicaid, Medicare, just a lot of wonderful resources that can be accessed on a national level, what other states are doing, what other initiatives are possible, especially with the push for teledentistry right now, since it is very timely in our country to utilize that type of service given that pandemic. So that is it's just a plethora of resources. We encourage everyone to engage. The recordings are not up yet from the national meeting since it just happened, but Open Academies is on the website. So we can go ahead and go. So what's great, they also announced when they had the national meeting that there is a website for Open, oralhealth.org. It is just a website to explain what exactly is going on in the network. What does the network stand for? What is the purpose of the network? Just a general FYI about the actual Open Oral Health without creating an account, because we recognize that you may just want to learn more about Open itself and may not want to create an account. So they created this wonderful website that outlines all the things that are that just explain the network as a whole. So we encourage you to check it out. It was put in the chat for those that just want to learn more. Next slide. And Celeste, you can take it away from here.
So for the virtual day of action was an open initiative, and we were able to interact with our stakeholders, policymakers, as well as candidates. And with that, we were provided tools to use through the virtual day of action guide, and that's in the chat. So you'll have access to those resources. It's an excellent tool that Open team members developed, and we were able to develop or adopt the Ready, Set, Vote for Louisiana, which I share with the coalition as well as other network members. And what I loved about the Day of Action, although it kicked off on September the 2nd, it's ongoing. So all the way through November the 3rd, we had materials that we could post to encourage individuals to get out and vote, to register to vote, and to become involved, as well as to share through the Twitter chat that happened on the virtual Day of Action on Medicaid, Medicare, in oral health funding with our members in our community as well as stakeholders. And the hashtags that we used were Mouths Matter and Oral Health Votes. And we will continue to have access to resources and messaging from the open network to continue working with legislators. As Melissa stated, we'll keep you posted, and you can also stay tuned for what's happening after the election in oral health care on November the 10th and November the 13th. Both those events are listed in open communities. Thank you. Next slide.
And next, we're going to take an opportunity to hear from you and to learn about what your thoughts are in terms of engaging, in terms of just next steps, and how to take, what Melissa has shared, what Celeste and I have shared, and how we can bring that together. So we have this opportunity now to participate in a Menti. If you are not familiar, there's 3 ways to get involved. We're trying to make it accessible for all. So your first way is to go to menti.com and type in the code to access the first question, which the question is, who are 1 to 2 partners you can engage to advocate for oral health? You can also access the Menti by activating it through the QR code, where you would simply go on your phone, go to camera as if you were to take a picture, and hover that camera over the QR code, and it should say open menti.com in a web browser like Safari. And the third option that was put in the chat, thank you, well ahead, is the link to the direct Menti. So if you don't want to type in a code or access the QR, you can just click the website in the link in the chat, and you can access the Menti that way. I'm going to give y'all a little bit of time to access that. So then that way we're ready to begin shortly. Again, it's just either going to menti.com, typing in a code, accessing it with your camera through the QR code, or just clicking the website that was posted in the chat, the latest link. I know there's been a couple of links that were posted in the chat, but it's the link to vote and then the menti.com website. I'm going to go ahead and switch screens. We have some responses in already. Thank y'all for those who have engaged. So the question is, who are 1 to 2 partners you can engage to advocate for oral health? So far we have in big with our word cloud schools, as well as non-traditional partners, the state health department, which is great. They work closely with the Louisiana Oral Health Coalition, so I agree. And for me, particularly working in schools, I completely agree. Like Melissa had mentioned, just, school ceiling clinics and things like that are just opportunities to engage. Medical school, dental school, yes, I agree. This is all great. AHECs, yes, the AHEC has a program called AHEC of a Smile. That's, they do school ceiling clinics in schools, so I agree. AHECs, we have legislators, health centers, just a bunch of great responses. School-based health center, yes. They're in the works day in and day out in the schools, so I completely agree. And we are still getting more responses. FQHCs, as well as Louisiana Oral Health Coalition, and churches. That is a great way. Additionally, and non-traditional partners that can just support and push those different initiatives. Great, this is wonderful. Thank you all for those that are responding and engaging. We can go ahead and look, it's still coming through. This is wonderful. So we are going to go ahead and go to the next question. We have one more question for you all today. So our next question, it's the same code, same website. It should pop up. If you already answered the first one, it should bring you to the next one. Within Open Communities, the new platform, or just us, Celeste and I, how can the state and grassroots representative collaborate to achieve your oral health goals? So with this partnership and this access to all these resources, we have been mentioning and talking about what are some ways that we can work together collaboratively to make oral health, to achieve your oral health goals. So we have 2 responses already: summits, forums. Yes, that is wonderful. And summits, a great plug to mention that in March of 2021, this is the pre-conference to the main conference that's occurring in March in Bossier, Louisiana. Town halls, establish monthly open meetings to the public partners. That's a great idea. Identifying oral health champions. I know the School Sealant group is possibly discussing an oral health champions program that may be initiated in our state. Continue to provide update blast via email, social media. Thank you for that. Share stories. Thank you. And I know Melissa had talked about how Families USA has a forum to share stories. I think that is something to touch on and capture in our state, because I think that voice is so important. So thank you for recognizing that. That's good ideas. Yes. Great. This is wonderful. I appreciate everybody's responses and level of engagement. I think it definitely is food for thought and things that Celeste and I can work on to help bridge, be more of a connector and bridge for everybody doing the work. Great work in our state. Okay, thank you all. We are going to transition back. Okay, so next we are going to talk about what's ahead. Next slide. So in all the discussion, you know, particularly around how to get involved, these are upcoming meetings for just this month alone through the Oral Health Progress and Equity Network. There's upcoming policy call, rule call, Medicaid call, Medicare and Medicaid call, and just continuing the conversation and continuing that initiative to get involved. So what's great about these calls is they are frequent. I'm pretty sure the policy call is bi-weekly. Our Rural Network Response Team, as a co-lead of that initiative, we meet monthly. Medicare and Medicaid, they meet frequently as well. So if you're not able to attend this month, don't worry, there's more opportunities. Now, we just listed the dates and times. A lot of the times they list the dates and times in Eastern Standard Time, just to note. I missed a call or two for that mistake, but we posted it here in Central Time Zone. And so, but to learn how to access, a lot of them are all via Zoom or via conference call. So just join the actual communities platform, and on the calendar, on the open website, it lists all these meetings and the Zoom links to join. So once you join the actual platform, on the calendar, you'll see all 4 of these events, and you can click the link to join. But if you're unable to make these actual dates and times, just stay tuned. They'll email out and say when the next meeting is. So once you're connected to that group, whether it's joining that community or that forum, they'll keep you posted on future meeting dates. So just stay tuned, or just connect with Celeste and I directly, and we can connect you and join those lists directly as well. So we are here to help facilitate that partnership for you, to make it as easy as possible. And so next slide, please. Like we keep mentioning, join the network and stay tuned for what's next. And our last slide, the next one, is just our contact information. Feel free to reach out to us to connect. See Terry at xhealth.com and me, Lisa, at eatmovegrow.us to learn more. You can connect with both of us or one of us. We are able and willing to assist you as needed. And we want to thank Louisiana Oral Health Coalition for allowing us to be on this webinar today. Thank you.
Our last presentation will cover raising the grade on oral health. Our speaker, Marcia Beatty. She serves as the Assistant Professor of Research in the Community of Dentistry Division at University of Oklahoma College of Dentistry in Oklahoma City. She is also the current chair of the Oklahoma Oral Health Coalition, a statewide network of individuals, agencies, and organizations that is focused on improving the oral health of all Oklahomans through collaboration, coordination, and education.
All right, thank you so much for having me today. It is my pleasure to join you. Want to talk a bit today about raising the grade on oral health, and I am pleased to be a part of your pre-conference webinar that's addressing this notion of getting a better understanding of oral health equities, and I hope I'm able to shed a little more light on that for everybody in the audience. Next slide. Okay, and this is a mission statement of our Oral Health Coalition in Oklahoma. You know, our goal, our mission, our focus is to impact the oral health of all Oklahomans, and we really focus on collaboration, coordination, and education. Next slide. This is a list of some of our member organizations. Including, you know, the Delta Dental of Oklahoma Foundation. The Oklahoma Caring Foundation is the nonprofit arm of Blue Cross and Blue Shield of Oklahoma, but we have all of these members, many of whom were part of the original Oral Health Task Force that was created back in 2007. Next slide. Yes, and so this gives you a little bit of our organizational history. Back in 2007, there was a concerned group of agencies and organizations and individuals who were really concerned about the lack of access to oral health for Oklahoma's children. And so they petitioned, they asked the then governor, Governor Brad Henry, to form a task force on children's oral health. And they began to meet. They met over the course of 1.5, almost 2 years, and developed a state task force report and the first state oral health plan for Oklahoma. There is a link here where you can access that original report, see who all was involved and what all went into that. One of the things, again, this particular task force and this report was focused specifically on children's oral health, which is a major, major concern. But then in 2016, our coalition really began to expand our focus to look at oral health across the lifespan, not just for children, but for adolescents and working age adults and for senior citizens, recognizing that the oral health of families and the access to care that families have significantly impacts that for children as well. In 2017, we developed our first strategic plan, and one of the key issues we felt needed to be addressed was on enhancing the public perception of oral health. And as you guys in Louisiana are doing, making that link between overall health and oral health and overall well-being. We developed some position papers for the first time over the course of 2017 through 2019 on community water fluoridation and early childhood caries. This was part of our effort to expand the public's perception of the importance of oral health. And then in 2019, we began our oral report card project, which culminated in 2020. Next slide. And here you just see examples of our position papers, which can be accessed through the link that's on this page and in the chat box. We took great care to develop these in a way that we thought was meaningful, that was easy to understand, and we did them both in English and in Spanish so that a broader members of our Oklahoma community would be able to utilize this information. Next slide. All right, so here we go to the Oklahoma Oral Health Report Card. It was developed over the course of about 1.5 years. It was released originally on May 29th. Our intent for it was to provide a baseline for future data collection efforts. As you guys have come to understand in Louisiana, and this is true for many states, oral health data, systematically collected and high quality oral health data isn't as widely as available as you might hope. And so that's one thing we wanted to begin to build on. We wanted to use the report card as a framework for developing this 2020 oral health improvement plan. Although since 2007, for example, there have been 3 or 4 overall health improvement plans developed for the state of Oklahoma, and not one of them made any reference to oral health. And so it clearly becomes obvious to us that there are some advocacy efforts that we need to engage on. We've already begun, and the report card has proven to be a wonderful foundation for advocacy efforts that we already have underway and will be expanding. Next slide. Just want to let you know that our report card was based off of a report card that we saw that was shared with us by our friends at the Texas Oral Health Coalition. Beth Stewart, who's actively involved with the Open Network and I know has been mentoring Lisa in particular, is an absolutely wonderful resource. They shared their oral health report card with us. And this one I think was back from either 16 or 18. And they earned a C+ grade. They looked at, I think it was, maybe it was the 13 indicators as well. Next slide. Next slide, please. And so this is our 2020 Oklahoma report card. We looked at 13 different indicators of oral health. We broke them up into certain categories. One, looking at specific indicators for children who are enrolled in Medicaid. Another set of indicators for children in the general population, whether they are Medicaid eligible or not. A certain category for adults, including those who are working age, as well as those who are 65 years older and 65 years old and above, and then for pregnant women, of course. Then some indicators for the general population related to access to drinking water, and then the percentage of oral health needs that were met in dental health professional shortage areas. One of the things I would invite you to explore here, and you can access the report card on our website using the link that's provided. Oklahoma in general scored incredibly poorly in almost all of these indicators. We scored a grade of D or F in the vast majority of these indicators, and this is as compared to the national average at the time. And then uniquely, we scored a grade of A in terms of the percentage of needs met in dental health provider shortage areas. But what this 40% means is that we were close to the national average or performed better than the national average, but the reverse of that means that 60% of needs of Oklahomans in dental health provider shortage areas were not being met. So let's go to the next slide. So this just gives you some information about the sources that were used. In all instances, we used very similar sources to were used with the Texas Oral Health Report Card. They're all typically readily available online data sources, from various federal agencies and reporting entities. We also used the Medicaid EPSDT participation report in order to get the information, for example, for children age 1 to 2. But again, all of this information is readily available for any state who chooses to create a similar report card that can then be used to help undergird your advocacy efforts moving forward. Next slide. And so this is just a little bit so the report card itself has 3 pages. There's the front page that has, the indicators and the scores. Then the second page is what you just saw. It shows all of the data sources. And then the third page shows the comparison chart as to how the scores were calculated. And the bottom line is, for any given, indicator, if our score in Oklahoma was 20% better than the national average, then we got an A. Okay, if it was 20% better or more than the national average, we received an A. If we were within 10 to 20% better than the national average, we got a B. And you see, so on. If we were right on point within 10% of the national average, we got a C. And if we were 20% or worse than the national average, we received an F. And so you can see then on the far right-hand side of your screen how the percent differences were calculated, how the points were graded, and then how the grades were distributed. Next slide. So one of the things that was interesting about this project, when we were deep in the middle of it and were working to finalize all of this data collection and analysis and reporting, I got an email also from some colleagues at our College of Public Health on the Health Sciences Center campus here in Oklahoma City. We are unique in that on this one campus, there are 7 health professions, colleges, medicine, dentistry, nursing, public health, pharmacy, biomedical sciences, allied health. And I got a call from some folks at the College of Public Health, and there was a young master's in public health student who was really interested in doing some data analysis related to our report card. Well, we were very close to finishing up the analysis and the reporting to develop our report card, but I met with this young woman who happened to be a foreign-trained dentist who was pursuing a master's degree in public health. And we thought, let's look at trends in Oklahoma over time, as well as in surrounding states. Next slide. Next slide, please. And so our primary research questions were, what were the difference in oral health status between Oklahoma and the United States over a period of time? Were there any trends in the oral health status of Oklahomans over time? And then this last one, how does oral health status in Oklahoma compare to surrounding states? And we looked at the states you see here: Arkansas, Kansas, Texas, New Mexico, and Louisiana. Next slide. And so while we did this analysis on all 13 of the indicators on our report card, every single state, this young woman did a masterful, fabulous job of collecting and analyzing and depicting this information in a way that's easily understandable. And so I just want to share with you a couple of these data items from this master's thesis practicum paper. One, the percentage of children ages 1 to 2 received a dental care visit, and this data was from 2019. In all instances, we used the most recent data available at the time. And so you will see, for example, the reason Oklahoma got an F in that category is that less than 16% of children in this age bracket in our state received a preventive dental visit, as compared to, for example, the national average, which was 26.2%. And Louisiana, you guys did better than the national average at 30%. Our friends in Texas apparently had it going on with respect to this particular access to care challenge for oral health, and they received an A with a 63.4% score. Next slide. This one depicts the percentage of adults aged 16 to 84 who had visited a dentist in the last year. And the most recently available data for that particular statistic across the board was from 2016. Looking at this, then the national average was 65.7%. Oklahoma was a little below that, somewhat significantly below that at 58.2%. Louisiana down the line at 56.6%. Next slide. And in this particular instance, we are looking at the percentage of adults age 65 and older who had lost all of their natural teeth due to tooth decay or gum disease. Again, this data was from 2018. The national average was 14.5%. Louisiana was at 20.5. Oklahoma was worse than that at 21.4. And our friends and neighbors in Arkansas, were even more challenged at 22.7%. In contrast, our friends in Texas were down at 13.7% and in Kansas at 14.0%, which was a little lower than the national average. But again, the range was from 13.7 to 22.7%. Next slide. Okay, so I want to visit with you just a little bit about health disparities, health equity, and social determinants of health to kind of provide a little more context for how some of these data items kind of come to be the way that they are, and how we can begin to focus our efforts on making significant and meaningful change. Next slide. So health disparities, have typically been defined as inequitable or unfair differences in the health status of different groups of people. And these differences are often related to social or demographic factors rather than just straight up ethnicity or genetics. And the impact is often most significant on certain population groups. And we can see how this has played out significantly with respect to the coronavirus pandemic. Next slide. So a number of factors, again, that drive health disparities, having access to affordable and culturally appropriate health services and human services, quality education being available in that community, at the K through 12 level, having affordable, quality, and healthy housing available, early childhood development and what types of programs and supports are available to help ensure that children are developing, in the most healthy and robust way possible. Having a healthy physical environment, both in terms of air quality. I grew up in South Texas where the oil refinery business was really huge and air quality was kind of a challenge there. I imagine that is very much the case in Louisiana as well. And so I remember having a brother who could not live in our hometown of Corpus Christi, Texas, beyond a certain age. He moved to California to live with relatives there because at the time, back in the 60s, air quality there was better than it was in South Texas. This notion of having access to affordable food systems and affordable healthy foods is also critical to driving and impacting this notion of health disparities. Next slide. So health equity then is the absence of unavoidable, unfair, or remediable differences among these groups of people. And this is whether we're talking about, from a social perspective, an economic perspective, demographically, geographically, or any other way you want to slice and dice it. The point is, when things are equitable, these unfair and avoidable differences are absent. Next slide. So health equity then is when everyone has the opportunity to attain their full health potential and no one's disadvantaged, from achieving that potential simply because of their social position or some of these other social determined circumstances. Next slide. So this brings us to this notion of the social determinants of health. And you just have to excuse me, you know, I teach community dentistry to our students here at the college. And so these are some of the things that I really work hard to drive home with them so that they understand that these factors really do come into play. You know, many times dental students come, not always, certainly not always, but many times they come from backgrounds where they don't experience this kind of challenge. Next slide. And so in Oklahoma, just to give you some insight into the demographics of our state, when we look at things like median household income, you know, the median income is $51,000, but it ranges from $30,000 to $69,000. When you look at the percentage of college grads, it ranges, you know, the median is 25%, the average is 25%, but it ranges from 1.5% to 36%. And you can see on and on and on. Next slide. And so when you look at, for example, that oral health indicator related to adult dental visits, you see, for example, that college graduates receive, you know, dental visits significantly more often than those without a high school education. With respect to income, same thing applies. Less than $15,000, around 30%, but if your income is $75,000 or more, you know, approaching 80% or more. Next slide. So what does this all mean? You know, one of the things I share with my students is that these inequities in oral health are really just examples of widespread systemic health inequities and social justice issues. And many of you have seen this graphic before where, you know, when you've got these kids trying to look over a fence at a baseball game, and inequality, everybody gets the same size box to stand on, but it doesn't necessarily meet their needs because everybody has a different set of needs. And equity, people's needs are met according to what those needs are. But next slide. This notion, I love this graphic even more so, talks about justice. And it's the notion that the barriers, the supports, the causes of the inequity, which was this wooden fence that people couldn't see over based on their height, was removed, the systemic barrier. Next slide, though. But what if fences of any kind, whether they're wooden fences, chain link fences, you know, these boxes that may or may not be available for people to stand on. What if these long-standing systemic barriers are not even necessary or appropriate? Next slide. And so this is just a slide that talks about the kinds of mindsets and approaches that need to come into play if health equity is really going to be achieved. Next slide. And then one of the things I share with my students is that multifaceted problems will always require multifaceted solutions. And so this schematic just kind of shows that, you know, you've got things from the macro environment, the population and community level, at the personal and individual level, you've got disparities of all kinds, but they're all different approaches that must be taken in order to address this program from a holistic perspective. Next slide. And so I share this often too. In many respects, oral health is kind of like the final frontier in terms of healthcare, health equity, and health justice. I'm an old Star Trek fan from a long time ago. Next slide. And so how do we get from here, where we are here, to where we want to be? And that, I believe, the road to that is paved with advocacy. Next slide. And so this is just a few notes about the role of advocacy. It's when people actively pursue, support, or defend a person, a group, a plan, a cause, a proposal, or even an idea. It's when folks work on behalf of others, either by speaking up on their behalf or supporting their cause otherwise. Next slide. And so health advocates are change agents, period. And you do that either directly or empowering others to affect change for themselves. Next slide. And so these are some tips for becoming an awesome advocate. These are some things that I picked up quite some time ago from an entity called the Community Toolbox out of the University of Kansas, and just give some tips for how to really do advocacy and do it well. Next slide. Just want to share, I too am a member of the Open Network. I'm the state representative for the state of Oklahoma, participated in the Open Capitol Hill Day back in October of 2019, and actually had the opportunity to visit not just with the staff members of some of our congressional representatives and senators, but in the centerpiece with one of our congressional representatives directly as well. Next slide. And so bottom line is just some things learned from this advocacy experience is that you've really got to be prepared. Robust preparation is absolutely critical to be successful. Go ahead. Next slide. And so I just can't emphasize enough all of the phenomenal resources that are available to each of you, both individually and organizationally, to participate in this advocacy effort to be impactful in terms of affecting change. Families USA, Open Network, there's another entity called Frameworks, and the American Network of Oral Health Coalitions. These are all entities that we are working with here in Oklahoma to help enhance our own advocacy efforts. Next slide. All right. And so bottom line is I share this little graphic sometimes. You know, I went from being a concerned and somewhat articulate community health educator to becoming a savage oral health advocate, you know, and savage is a term that's sometimes used by our younger people these days to refer to folks who are absolutely just committed and focused and determined, and you won't be deterred. You know, if we are indeed going to impact oral health in the ways that we would like to, we hope to, and we need to, we have to be savage about it. Not milquetoast, savage, absolutely. Next slide. Next slide, please. And so for us in Oklahoma, we determined that our oral health, from our report card, that our oral health delivery system needs significant change and improvement, you know, needs assessments need to be implemented at regular intervals, and that these oral health advocacy efforts absolutely have to be expanded. Next slide. And so we have developed a webinar series that we're calling Raising the Grade on Oral Health. And we're looking at different issues and segments of our population in terms of dealing with that. We had a webinar actually scheduled for today, which was postponed because we had a severe ice storm here last week, and a lot of our folks are still without power or internet. But you see this, and any of you who are interested in logging into any of these, you can go to our website and check out the information and register and participate. Next slide. And so we too will have, hopefully, an in-person forum, Oral Health Awareness Forum, in June of 2021. We had originally planned it for March, and of course the pandemic got in the way of that. Next slide. So again, and much like you guys with the Louisiana Oral Health Coalition, we're focused on building our membership. You know, we've reactivated our membership in the American Network of Oral Health Coalitions because they've got wonderful resources, as I mentioned previously. You know, expanding and engaging more robustly with the Open Network, absolutely. Developing advocacy tools and resources, which these other entities, Frameworks, Open, ANOC, Families USA, can really provide some strong support and insight and guidance on how to do that and do it well. We've also began to launch for the very first time some social media campaigns and outreach. We will be working on a 2020 oral health improvement plan. And one of the things we really want to emphasize is building and strengthening regional partnerships. Lisa has talked about that. Next slide. And so what we learned, for example, from our surrounding state analysis, that, you know, many of our neighbors and friends in surrounding states have the same kind of challenges we do. And that coordinated regional efforts where we share information and we actively engage in these learning collaboratives together can really be essential to all of our success. These collaboratives with the Open Network, that's how I met Melissa and Celeste and Lisa and so many other people. And I challenge you, our friends and neighbors in Oklahoma, let's just get in Oklahoma and Louisiana, let's just get jiggy with it, y'all. We don't have time to play. Next slide. And so the bottom line is, if you are willing, everything that you need, if you have a heart for being an oral health advocate, you can become a savage, beautiful butterfly oral health advocate, not just a caterpillar running around nibbling on this and nibbling on that, but you can become a savage oral health advocate too. Next slide. Okay, this is something that I just share. I'm not going to show this, but I had the opportunity to participate in a filming of a documentary. It's called Hidden Pain. It's America's Oral Health Crisis. And the links here, the first one on the left takes you to a short, about 2-minute version of that documentary, and the one on the right takes you to a longer, more detailed, about 11-minute version of the documentary that just outlines the oral health crisis that exists in the United States for children, for working age adults, for senior citizens, for people across the spectrum. And so I encourage you to take a look at that when you have some time and opportunity. Next slide. That is it. All right, thank you.
So we currently do not have any questions in the Q&A box. So however, now is the time to enter any questions that you may have. I do see something in the chat. Will we be able to have access to the webinar recording in PowerPoint? Certainly. You guys do have access to we'll have access to the webinar recording and PowerPoint after this session. So if anybody else have any questions, now is the time you can enter into the chat. I'm sorry, into the chat or into the question box. You're welcome. Okay, so we'll end this session, and again, information will be sent to you, and we'll keep going forward. Okay, wait, we do have a question that just came in the box. Is there a rescheduled date for the webinar on special groups?
So if that's for us in Oklahoma, we are looking at doing that on December 4th, at just pushing the date down and doing the special groups on December 4th, and then dropping the other subjects down along the calendar. So if you will are interested, you know, go to our website. You can join our mailing list, and you'll get updates on absolutely everything once those things are finalized. We're in the process of having to re-engage with our speakers and presenters.
What I can do, I'm actually part of the Oklahoma Oral Health Coalition. This is Lisa Staples here. So when that information does get released, I can forward it on to the coalition as well.
Awesome. Thank you, Lisa.
Okay, thank you. So our upcoming events include virtual member quarter meeting, which will take place in January 2021. That date is to be determined. Next, the Children's Dental Health Month activities. There'll be several activities taking place throughout the month in February 2021. And then last, the Louisiana Oral Health Summit that was talked about earlier on. The in-person summit will take place in Shreveport, Bossier City on March 12th, 2021. Here's our save date information, and more information will be coming throughout up until that time. Currently, we are forecasting it to be in person. However, depending on the upcoming events and this pandemic, it may be virtual. But again, more to come on that. You can contact the Louisiana Oral Health Coalition by email or visiting the website. Our executive officers are Sue Ketchens is the chair, Dr. Billy Hall is the vice chair, Annette Drody is the secretary. We'd like to thank everyone for joining today. Thank you, Well Ahead Louisiana, and all of the members of the Louisiana Oral Health Coalition. You will receive an email after this webinar to complete an evaluation survey. Please be sure to participate. And again, we thank you for your support. We hope to see you at our annual Oral Health Summit on March the 12th. Have a great day.